And Kendall, I don't know if, there we go. There he is. All right.
Have a new computer and supposedly it won't dump me. So,
That's the good part. I waited for you, Dr. Owen. We'll go ahead and get started. So everyone, welcome as always. We appreciate you joining us for today on February 25th. Thank you for joining the Tryon webinar. We appreciate it. I want to tee up two things for Dr. Owen. And you've heard this from him the last 2 weeks. He's given you a precursor of what's come out in the media this week. And that is about a faster and better vaccine administration. So we have a couple articles we'll post to our website. And if you'd like for us to email those to you, put your email address in the chat and we will be sure to get them out. And you know, he's got some fire around this topic. So I expect to hear the same from him today as well. And the second thing I'll tee up is the loosening restrictions that go into place tomorrow. We've got a slide on that we'll share as well. So go ahead and start feeding us your questions in the chat. I will
let's jump in.
I will watch those and let's jump in. There you go.
All right, so I'm using a different computer so that it's dedicated directly to the web here. So I'm not used to this camera yet, so sometimes you might see me looking down. All right, cases are going down. Unfortunately, we saw just a tiny blip the past day or two. Hope that doesn't continue. The new reported hospitalizations obviously are going to decrease as well. A couple of weeks behind, this is the same thing that we've seen previously, and deaths also decreasing. Now, a little concerning though that we saw a little uptick in the death rate there. I think it's going to come down, and it's just one of those little statistical blips that we saw a couple of weeks ago as well. And hopefully that won't continue. But we're down about 37% over the 14-day change, and that's a huge improvement. Next slide. So my first question to everybody is this loosening restrictions in North Carolina. So as soon, let's put it in a medical way of looking at it. Okay, somebody has high blood pressure and they're on 2 new medications to control the blood pressure. It's been really high, 180 over 110. And we've got it now down to 130 over 70. Awesome. Patient has no symptoms. Here's the question. A, do you maintain the medications? Or B, because the blood pressure is controlled now, you stop the medicines because the pressure is controlled. Well, that's what's going on here in this slide. The blood pressure is coming under better control, so therefore stop all the medicines. That's not what needs to be done here. We realize we need to ease restrictions from our mental standpoint, from a financial standpoint, all those things. But from a control of the virus standpoint, we've got it on the run. Now's not the time to take our, foot off the gas with this. So unfortunately, there's a lot of political pressure that's making the governor do what he's doing. But you can see North Carolina is going to ease restrictions, going to modify the stay-at-home order. Mandatory mask wearing is still needed. Gyms, restaurants will be opening up. What do you think that's going to do? That's going to increase our cases again. Right when we got it down and on the run, we're going to allow it to come back. And then we're going to deal with what? Spring break, Easter, and a third wave. And we're going to reduce restrictions. We need this to be as low as possible before those things hit. And I really am concerned that we're going to see another significant wave as a result of that. Hopefully it'll be tamped down somewhat by the amount of vaccine that we've given, but it's not high enough yet that we'll show here. Okay, next slide. So remember, you don't stop blood pressure medicines just because your blood pressure is controlled now. Same thing. North Carolina last week was a darker gray or green, and we fell a little bit behind some of the other states who are getting their percentages higher. But North Carolina's got about 13.1% of the dose, at least one dose, two doses, 6.8%, and the US total is just barely behind that, but we were a little bit better last week. I don't think that we should revel in our success. At this point, it's not good enough yet. And I'll go through some reasons why. These articles that are being sent to you are things that I decided that it was just time that we just couldn't mess around anymore about the administration of this vaccine. And we just needed to have the voice out there that says there are better ways to do this more efficiently. Give congratulations to all the people who are working hard to deliver this vaccine, but there are still better ways to hone this and make this work better, more efficiently, and proactively get ready for this. So you'll see some of those articles. Please take a look at them. What's the chat question?
Why are the adults who are at high risk for severe illness being vaccinated just before the general population?
Okay, so at the beginning of this whole process, and I look at this like a tree trunk with a big oak tree and all the leaves out on the periphery of the tree. And the people who are the most vulnerable are these leaves and the highest risk of dying. At the beginning, it makes sense ethically, morally, so forth, and medically to vaccinate those at highest risk. But after the community has learned that who's at highest risk, the vast majority of those people are not practicing unsafe techniques. They're staying at home. They're double masking. They're wearing gloves, all those things. The spreaders are the general population, not the people at highest risk, because they're avoiding the population as best as they can. So if you look historically, I mean, from even the bubonic plague and the Spanish flu, it's always been the youth from about ages 15 through age 35 to 40 that's always been the super spreaders. And I get why we would vaccinate the high-risk people initially, but it's time, I think, to look back at who's been vaccinated and what's the best strategy to prevent a mutation from occurring. Is it to keep vaccinating the leaves of the tree or vaccinate the tree trunk that spreads it to the leaves? I'm hoping we'll see a pivot in the philosophy because I think it's due. Next slide. It's amazing how I need these glasses more and more each time. So new reported doses administered each day, 1.4 million average. We peaked. How could we peak? I mean, we need to be going up, up, up. Look to the right. You remember when it said 70% of the people were going to have their first dose by September 5th, and then it said September 13th, and now it says November 20th? That's not very encouraging. Now, that could be a supply issue. But I really think that there's more than a supply issue at hand here. I think that there's a distribution issue also. And that's what's not really being talked about right now. And that's what I've decided that I'm going to go out and tell the public, because it's pretty straightforward. If you have 100 doses, is it better to give them 20 a day for 5 days or give them all in one day to be able to tamp down the viral load in the community? Well, it's pretty clear. The earlier you can give it, the better off you are. Those people are not likely to catch it and spread it. So why aren't all of the portions of the medical community involved in getting these vaccines out? Why aren't the private medical groups, independent medical groups all across the state that are about 15% of the total amount of population, taking care of at least 15% of the total population, just amongst the 10 largest groups? But it may be a third of the population amongst the entire primary care group of independents across the state. Why aren't they involved? Why did pharmacies get involved so late for the general population? I think that it's critical that we involve the entire medical community. It's going to take independent doctors, hospitals, pharmacists, and the National Guard, quite frankly, all across this city, county, state, and nation to be able to make this work the fastest. And when the vaccine supply increases, if we don't have the infrastructure for distribution very sharply honed and ready and efficient and capable, we're going to create a different bottleneck. Right now, the bottleneck is supply. But in the future, if we don't open up the distribution capability, then the distribution with so much vaccine coming in will then be the bottleneck. And that's why we really have to open this thing up widely. I congratulate and laud and appreciate tremendously what the private sector with Mr. Tepper and Honeywell and the hospital systems are all doing. That's awesome. But it's still taking them 5 to 7 days to get the amount of vaccine they have delivered. And that's because they're doing the best they can. We need more people vaccinating. And the only way to do it is to unleash and really open up the independent physicians and the pharmacies. We got to stop worrying about marketing, PR. That's all a bunch of baloney. I mean, this is a fight against, it's a war. And it's a common enemy that's just hard to see. But we all have to lock arms together and make this work. And forget about the pettiness of who got this amount or that amount, and so forth like that. It's just critical that everybody gets involved.
Dr.
Next.
Owen, we got a comment and a question.
Yep.
You ready?
Yes.
So the comment is on something you said earlier. Vaccinating the super spreaders makes sense, but seems like perverse reward for bad behavior.
Okay. Yes, it does seem like a reward for bad behavior. However, we also have to take a practical approach. And the practical approach is they're the spreaders. Get them off the market. And the only way you can get them off the market, because they're not going to behave, you can't solve that. We've proven it. It's been proven over 1,000 years with every pandemic. They're always the people who are spreading it. We've got to vaccinate them and get them out of the situation of spreading it to everyone else.
Okay, next is a
And
question.
it is irritating that it's lauding bad behavior. I get it.
Yeah. As new vaccines come online, is it your opinion folks should get any vaccine available that's been approved in the US?
At this time, with the information that we have, don't worry about which vaccine you get. The important thing, as I said last week, it's not about the effectiveness of the vaccine preventing infection. It's 95% for the 2 mRNA vaccines. It's 75% for the Janssen. What is critical to the death rate and so forth is every one of them has 100% capability of preventing serious infection and hospitalizations. So whichever one you can get hold of it as soon as you can possibly get it from whomever you can get it from.
And then
Now,
last,
that could change if one of these mutations or mutant strains demonstrates that one or more of these vaccines is less effective. Remember, the Janssen trial was done in areas around the world that already had the South African viral strain out there. The Pfizer and the Moderna trials were not tested against those strains initially in their studies.
All right, one more. Are medical groups or associations like Tryon or groups of doctors, are you talking to the governor and the Biden administration about this?
Well, I spoke to the Biden administration at the beginning, before they ever launched their presidency. And so I was involved in that portion of it. This past week, I just did not see any change in the behavior of and the policies of how the federal government or the state was going to handle this vaccine, and I thought it was time to act. And you'll see in those two different articles that we're sending that that's exactly what I did, and brought up the fact that that's really critical at this time. All right, so we've got to move really quickly at getting every group possible available and open to be able to give vaccines across the state and nation. And, the primary care doctors, all the independents, all the pharmacies and so forth, that's going to be a critical part of this. Okay. And yes, we are, I hate to put it this way, but it really takes putting the heat on the state. Nobody wants to have to do that. I didn't want to have to do that, but we had to do it. We were forced to do it because it's an inefficient way of delivering vaccine currently. It's not efficient enough. It's not fast enough. It's not effective enough. And it's going to be woeful when the supply of vaccine increases. The distribution is going to become the bottleneck then, and we've got to get everybody else ramped up quickly. All right, next slide. So this is a pretty interesting slide. A lot going on here. Let's start on the left. What is herd immunity? Look at total immunity and look at vaccine immunity. So the bottom one, the darker orange, is vaccine immunity. We don't have a lot of that yet. Total immunity, it looks like we've got 40% immunity. That's not documented. This definition of total immunity has to do with what's been documented and what is theoretically out there that probably never got tested, all right? And that's the issue. So that's what they think total immunity is going to be. But look how for pure 100% vaccine immunity to get there, it's going to be about November 10th, okay? Well, if we, now look at the top of that graph, top left, current pace of 1.7 million shots per day. Then if the supply increases, which we're talking about, and then what happens if there's a huge supply increase, 5 million shots a day delivered, you can see total immunity gets there by about July. But remember, that's assuming that we're correct about how many people really have had this COVID infection and not necessarily been tested for it, okay? So now look to the right. And what if the pace immediately increased to 3 million? Okay, today, not later, but today. Well, we should probably be able to have things ready by herd immunity by May. But there again, we don't have one chance in where of being there without the amount of distributors and distribution capability increased, in my opinion, somewhere between 5 and 10x of what we have right now. But I'll bet you that if we opened up capabilities across all the independents, the pharmacies, the hospitals, and everyone, I'll bet you we'd get there by May. But we're going to get just inundated with vaccine probably in the somewhere of 6 to 8 weeks. Because remember, we're so used to hearing about Moderna and Pfizer, but Janssen's going to come online then. And they're going to have about 40 million over a period of months and doses, and they only need one. So we'll see. I mean, that takes 10%, 12% of the people off the table. That's a big deal. Next slide. Here we are with our groups again. I will tell you that in phases 1B and 2, just the 1Bs. And now we are moving into phase 3. And I'll bet everybody thinks that that means that we've done all of the phases 1, 1B, and 2s and gotten them all vaccinated. And that is completely incorrect. I would say at least half of my patients who are over 75 still have not been vaccinated, and they have appointments at hospitals to be vaccinated in April. Now, that doesn't fit. That doesn't work. If we're trying to keep the people from dying, we need to bring those people forward, and they're not doing it. They're opening up phase 3 for students, which I laud. I'd like to see all the lines blur and just get everybody vaccinated that could possibly be vaccinated as soon as possible. And I also believe that one of the things is, and this is near and dear to all of your hearts, is I think that employers are perfectly situated and positioned to be demanding from the state at the DHHS level, we can help you with some of that, that you need to be demanding to be a point of distribution. We're happy to help be that distributor of vaccine for you and bring teams and so forth. But they're not really allowing enough of that across the nation right now. But many of you have lots of employees that are of the less well-represented, quote, previously known as minorities, including the African-American and Hispanic populations. That would be a great way to be able to get into those communities through their employers and then create ambassadors within their communities to get this vaccine. So I'm pushing very, very hard on that as we speak. Next slide. All right, here we go, the frontline essential workers. I mean, I'm glad I don't have to memorize this. Can you imagine being one of the people that is supposed to screen the folks wanting a vaccine and having to go through all of this? This just reeks of bureaucracy and bottleneck creation. And I mean, it does. People have got to be trusted, and there will always be people who break in line. That's always going to happen. We can't prevent that. That's human nature. One Medical got blasted on NPR and writing too about vaccinating the high-level employees and the executives and so forth, and breaking in line and all this kind of stuff. You know, that is so minuscule in the process that in some ways, I hate to see anybody waste their time, effort, and ink on that kind of an effort when it could all be much more focused on opening up the distribution sites. That's where the media needs to concentrate on. Not that somebody didn't follow the exact rules perfectly or somebody tried to get away with something. That's always going to happen. We're not going to stop that. But here are your frontline essential workers. Any further questions?
Dr. Owen mentioned reaching out to people in Raleigh. And we have had one employer, and I'm not sure if she's on here today, but has done that, gotten communication back. I was just texting with Kendall to see how we want to get that out. Kendall, what would you suggest?
I think if whoever wants the information can just type their email in the chat, that will be the easiest way, and then I can send it all out at once.
Okay, do that. If you're interested in emailing, we know that there are responses coming back. All right, Dr. Owen, I don't see any other questions. We got 2 minutes.
All right, so I'll try and wrap it up real quick, and if you have a question, interrupt and, bring it. We can't let our guard down now. This is like high blood pressure. We've got it under control. The last thing we need to do is stop the medications. And the last thing we need to do is loosen all of the social pieces of social distancing and so forth. Now, I know for mental health, we need to open up. For a lot of other reasons, we need to open up. For control of this virus, we need to stay as clamped down as possible till these vaccines have their greatest effect and we can get as many of them out there as possible. Number two, we need to increase the distribution centers of vaccine tremendously. It shouldn't take 5 to 7 days to deliver the 120,000 doses across the state. It should take 1 day. And the reason it doesn't take 1 day is because there aren't enough distribution sites. It's also going to be critical that that be the case when this supply increases, because otherwise we will become the bottleneck. The distribution sites will become the bottleneck when we get overwhelmed with the amount of vaccine that's capable, and we won't have the ability to get vaccine in people's arms because there won't be enough people doing it. So it doesn't make any sense to not have opened up widely the distribution capability across the state. We're going to yell and scream about it and make sure that everybody hears it and understands it. It's really important. We've got to keep the heat on. Not to be malicious. This is a goal to win this war. And everybody with a good idea needs to be listened to, and it needs to be taken to full effect and advantage of. And this will help significantly. The last piece is, I think it's time to pivot and discuss whether or not we need to re-strategize who needs to be vaccinated. A lot of the people who are older have already isolated themselves. They're not out in the public. The spreaders are the young folks. And I believe personally that if we pivot, I'll bet you we get to herd immunity even faster because we're going to tamp down that viral load significantly more by doing that.
All right. Well, then
Everybody
with
has a
that,
good weekend.
as Dr. Owen said, have a great weekend. Thank you all for joining us. Stay safe and take care. Bye now.